So I'm going to start with my journey from being diagnosed with amyloidosis hereditary, doing the DNA test in August, my results coming back positive, full major cardiac workup that eventually came back that I needed open heart surgery. The decisions was tough to make that decision to get major surgery. Never had major surgery in my life. Getting diagnosed with amyloidosis. Fortunately, very blessed that it wasn't in my heart. I do have neurological decline. It's mild right now. But it's definitely been a process for anyone that's going through the DNA workup. I'm going to say definitely get your affairs in order before you even start the workup. One of the things I wish I would have done before I actually did the DNA test was to probably up my life insurance. Pretty cool with medical because now it's considered pre-deposit diagnosis, so I can't really do too much about the health insurance other than stay connected with the larger group of the amyloidosis program. But I would advise anybody before you start the DNA workup to definitely get some type of update on your life insurance, because once you get diagnosed, it's going to be difficult to get major life insurance policy updates. So with my workup for amyloidosis, that's how I found out that I had coronary artery disease, which led me into making a decision to have surgery. And today I am 29 days post-op. I would say overall doing well. It's still a process. It's still a healing process that they say takes 3 to 6 months to actually complete the healing process. So today is my 29th day. Feeling pretty good. Still have some discomfort in my chest area from the incision. But overall, I'm getting out, walking. Should hopefully start cardiac rehab in about 2 weeks after I do my post-op appointment. And this video is just to start the process. I will talk more about the coronary artery disease surgery, open heart, CABGx3. But first, I want to go into about getting a diagnosis. I was diagnosed after my daughter. She tested positive for the gene that causes amyloidosis in June. It was recommended that her parents should get tested. I actually got tested, and I actually tested positive for the disease, which was kind of shocking. I knew one of her parents had to have it, so getting tested and testing positive definitely created a lot of anxiety because it's a lot of tests. I thank God that I live in a major city and I actually have options for amyloidosis clinics. I chose one affiliated with my job. It's a smaller clinic, but I think they're smaller but more effective as far as getting testing. It took about 3 weeks to start my testing. Tests consist of a PYP scan, which is a nuclear scan, a lot of blood work, urine. After that, I had to do a nuclear scan for cardiac disease. That didn't come out too well, which sent me to the cardiac cath lab. And the cardiac cath lab definitely didn't go the way I thought it would have been, that if it was blockages, that they would be able to fix them with stents. My cardiac cath lab, the cardiologist actually pulled out of the procedure because of the work that needed to be done. From there, I was sent to a cardiac thoracic surgeon with the option of doing bypass surgery as opposed to stenting. The drawbacks to the stenting for me, because I have the gene that causes amyloidosis, that if and when I get amyloids in my heart, they could possibly be inside the stents. They could get caught inside the stents. And at that point, it would be, my options would be less enhanced as opposed to stenting or coronary artery bypass surgery. So it was in my best interest that I probably go for the more extensive option as opposed to the least extensive option. So I went for the best option for myself. We're going to finish this discussion. The next topic we'll talk about is uh, having a consultation with the cardiologist about surgery. We'll go more into depth with that. That was a very hard process for me to make that decision, but we'll go more into detail about how I came about to go to that decision.